During this session, I'll be demonstrating how to use digital technology to plan an implant placement using guided surgery. This was part of a live hands-on course where the students got to place implants after planning and then making templates through printed technology. What we're going to do is an introduction into Nobel Clinician, which is now called DTX Studio. So with DTX Studio, there's going to be an application on your computer. If we open this, and I'm going into a planning session with DTX. So with DTX, it is going to allow us to integrate an X-ray, which is a DICOM file, and also a file which is called an STL file, which comes from either an STL comes from a scan of the patient intraorally with an intraoral scanner, or with a benchtop scanner scanning your model. So when you do those two things, you can put those together and do the planning. So I'll go in, it's all password protected because it is a patient file, and we have to have it password protected. So I have a number of patients that are in here. This is my filing cabinet down on the side. Okay, so this is where I file the patients and when I want to come and go forward and back. So I can import files, so I have files like that I can take and bring from you or from Luke or wherever, or if I'm going to make a new patient file, I would come in and click new. You're usually going to work from the left to the right. So you click on new, and so I'm going to create a new planning session. Okay, so it gives me a false error there. That's the one I was talking about, Luke. So now it says, it tells me I need to import a DICOM folder. Okay, so the DICOM folder, I'm going to go on my computer, and so Wendy puts these in my folder. So for in here, these are patients that we've been working on. Okay, so over the last month or so, maybe 2 months. So in here, I'm going to look for Bernie, because Bernie Scott. So I can come in and say, okay, where's Bernie? But we actually put Bernie in, I moved him into the folder that I gave you on the jump drive. Remember I was looking for this yesterday? And so Bernie's in this DICOM folder, so under Dr.MacLean. So I'm just going on the computer where I've left the DICOM. So here's his DICOM and here's his STL. So these are the two files we're going to need to plan. So the intraoral scan, which was done by Leanne, and then the DICOM file, which was also done by Leanne. So we open up Bernie, and then there's the DICOM. So if I look at a DICOM, the folder itself is a bunch of slices. So these are DCM slices, and the computer's going to put all those slices together. So there's, let's see, a couple hundred in here, okay? So these will be put together. So if I go back to the main folder, then the main folder is going to say DICOM. So I'll open that, and it automatically brings an X-ray into the computer, like this. So if we can see that, then we can know that that's the file that we're going to be working on. So I'll click next, and it's going to bring this in. I'm going to put this into focus. So this is called an ISO value, and normally they set this so that it automatically happens, and I just haven't done that. So you see I'll put it on here so I can see the jaw, I can see the mental frame, and I say next. I'm going to mount this on the articulator. It's like a digital articulator. So I'll bring this down to the occlusal plane. There's the lower, say finish. And with this, you can see that now I can move this file around. I can turn it into an X-ray view. I can turn it into a bone view, other views. So I want to have it on X-ray view. And now I want to mirror. So you can see here, this is typically how we used to plan. I used to see, there's the nerve, we're going to put an implant in here. But I don't know where the teeth are, I don't know where roots are, I don't know where anything, what's happening. So if I look at this, I need to kind of understand that information. So I'm going to come over to the next, and it's going to be, I can adjust the reslice curve. So this is already pretty good. All this means is it's going to go around the circle and look at this round object in that position. So I can change the size of this as it goes around. I can make it bigger or smaller, like this. So that my window that I'm going to see when I'm driving, this window here, is going to travel around the jaw in a certain path. So I'll go to the prosthetics, and I'm going to now bring in a dental scan. So I'm moving from the left to the right as I'm planning the case. So I go to dental scan, and I'll select a dental scan now. The dental scan on my computer is also in the same folder because I left it on that jump drive with you guys. So it's on the jump drive, and I'm going to look in the file. It's in my dr.maclean file, and there's the file. So in here is an upper and lower. Now we're working on the lower. So the lower is our kind of jaw of interest, so we want to bring the lower in first. So this is a file, and you can see it's a 3-shaped trios file, and so there's where we want to place the implant. We're going to be building the template to fit this because this is a super accurate, higher accuracy than a PVS model. Okay, so there's no bubbles, there's no kind of hot and cold expansion, a whole bunch of issues like that. So we look, we're missing a tooth, right? Which tooth are we missing?
4-6.
4-6, so I'm going to take the 4-6 off. And I look and say, okay, all the other teeth are there, so I'm fine with this. So I'll say next. Now, you see on the end of my cursor, there's a word there, it's hard to read. It says, click on tooth 3-7. So I go click on tooth 3-7. It says, click on tooth 3-3. Click on tooth 4-3. Click on tooth 4-7. What we're doing is orienting this model to the x-ray. So I'll say next. And so you can see now that I can move around, and I'm going to check it in a tripod. So I'm going to look back here, and you can notice that this is coincident with the tooth. So I know that's in what they call alignment. If I come out to the front, this is in alignment here. And then if I come out to the other side, this is also in alignment. So I know that those two have mirrored each other, and that everything is good. Okay, so now I can start to do some planning. So I'm going to clean up the model because there's a little bit of kind of scan stuff on it. I'll go back to the patient, and I'm going to just take this, and I'll actually just cut the teeth off because I don't need the x-ray teeth now. They're kind of redundant, so I'll cut them off and see the mouth, and I know that these two are in the correct orientation according to where the jaw and the nerve and everything is. Because the most important thing that I'll teach you is you need to stay away from the nerve. Okay, you do not want to have nerve paralysis because you didn't pay attention or things like that. So this nerve is really critical to me. So when I'm going in here, before I plan the implant, I'm going to be thinking I'm going to place the implant between the nerve and the bone. And I want to have 3 millimeters of soft tissue above that. So I have a spot where I'm going to put the implant. I don't know what the implant length is or width is because I haven't looked at that on the x-ray. But it's going to give me an indication about those things when I'm going through. So if I go back in and I'm going to go to, look at things, I can take diagnosis and measure the ridge and say, okay, this ridge is 11.2 wide. But that I like to see the implant rather than to know how big the ridge is. It's nice to know, but so I'll undo that because that just doesn't give me great information. So what I'll do is I'll come back in and we'll look for the antagonist. The antagonist is going to be the opposite arch. So if you're working on the lower, the antagonist is the upper. If you're working on the upper, the antagonist is the lower. So I'm going to take the upper here and bring that in. And this has already been oriented with the bottom model when we did the scan. We scanned this and put it together. So when we sent it to be processed, and you can see he has an anterior open bite, we'll see if that's actually accurate when we look at him today. This tells me he's got a little bit of joint problem if he has that. Okay? So, and he has flat teeth, he does not have canine guidance, so he has probably flat articular eminence in this case. So, he's going to have a lot of posterior wear and a lot of function. So our goal now is to plan with this. So I can't see, you see how the window stops at the edge of the teeth. So the area of interest is really just where we're looking here. Now you can see here, I came across the mental foramen is right here. Okay, so the mental foramen is showing across here, but I want that to be showing so I can really see it. So as I move sideways and go to the next spot, let's say finish, go into diagnosis, I can go in and I can remove teeth in here, but I don't like to do that, but I want to find the nerve. So here the nerve is showing quite nicely, and sometimes you have to move this to show the nerve, You see the other side shows better when I move this object back and forth. Or you can do an adjust the nerve reslice if you need to, and you can move the lines to make it go up and down, or if you move this one, you can move this down up a little bit like this. So we can say finish. And so I have the nerve showing now, and I'll move this to focus it a bit more. So there's the nerve. As I come down, and I'm coming along the nerve, that's all I really need, but I'll finish mapping the nerve just because it's being thorough. So I'll come out through this area down here and finish the nerve. So now we've done most of the things in here. We can measure stuff, we can do angles, but we're going to move to the next window, which is planning an implant. So what I'll do is set the focus, and I'll move the focus right here. Okay, so I'm going to set the focus. There you can see the nerve down here in green. So we've got a lot of bone here. We've got thin tissue over top of his ridge. So his biotype is thin, and he's got a kind of a mountain and two kind of lower parts of the mountain down here. So my incision for this case is going to be right in the middle, but most times my incision is going to be in here, but because of his tissue. Now this doesn't line up on the top because this is lining, the upper model is fitting to the lower model, not the upper scan. Excuse me. So our job now is to plan an implant. So we're going to start by pretending that it's coming in. So we're going to put the first mark right here, and then we're going to put the second mark down here. So our goal is to place an implant here. So we're going to be using today for the course a parallel conical connection, also Noble Active are my two favorite. Okay, so I'll select that implant.
So you just put like the parameters of where you wanted it, and it gave you a suggestion of which one?
So what I'll do is do it again, okay? So I'm going to do it again. I'm going to reverse this, and I'm going to come in, set the focus where I want to place the implant. Then I'm going to take the implant plus button up in the corner, and then I'm going to come to be over top of the ridge, and you see my little crosshair? I'm going to put that where I want the drill to kind of go in, and then move down, and so maybe I'm over the nerve about here, and then a window is going to pop up. So I'm clicking, a window pops up, and on this window is a selection of implants. So I could put in any different one from Nobel, or you can even choose different companies and plan your implants. But this is saying where I clicked was about 13 millimeters long. And if I want a narrow implant, which I don't here because I want to have something stronger, I want to have something like a 5.5. So I'm going to click a wide platform, 5.5, and it's going to be 13 long based on those two dots that I clicked on here. So I select the process. So now I clicked here and here. It's saying that you can have, 13 millimeter implant, and you have a safety zone in yellow around the implant showing right here, and then there's the nerve down underneath. So when you do this, I'm going to go on the top. This is kind of like your driving area. So in your car, your stick shift is everything is right here that you need. So I'm going to go back to choosing, and I'll use the implant, and I can move it up. So if we said, okay, let's put it at bone level. And I teach that right now because I want you to understand that that's not where it should go. So if we look at this, we can now rotate around the implant. So watch this window. As I rotate around the window, the view of the window starts to change. So how do you like that position for the implant?
It's too distal.
Too distal. Okay, so you want me to move the implant over to the mesial a little bit? Like that? How's that?
That's too much. A little.
Too much? Okay, so I'll move it back.
Yes, that's good.
How about there?
Yes.
So you're looking up here. This also gives us an indication of where this is, but I don't know where the tooth is still.
Mm-hmm.
So if I come up, I can get rid of the top model. So I'm going to turn the antagonist off, and I'm going to look at this from the top. So I can click over here and look at it from the top like this. So that's the bottom. So now, how do you like it there? It's still difficult to tell because we can't tell where the tooth is going to be. So what we can do is come back up and go into the prosthetics and do what's called a smart setup. So smart setup is going to put a tooth right there. So wherever I choose over here, it's going to put a tooth over there, and it's going to look at the top arch, the antagonist, the bottom arch, the two teeth, and then put a tooth in there to give us kind of an estimated tooth where it should be. So we'd like to have that here. If we have multiple implants, it's even more important. If we have like a whole arch, then we have to have setups in there to know what's going on. We can even look at the antagonist and say, okay, do we like the position of the crown to the antagonist? And it's okay. He's got a little bit of a cross bite here. Okay, so that's part of the reason he's got a little bit of a jaw issue, very flat occlusion. So we say finish. So now that's there. How about this now? So if I like where that is, I can take this and move where I want the screw channel to come out. This is the implant position. I can also have the screw channel different. But to me, this looks like it's a little bit more angled this way, so I might take this and tip it over this way. And then move the whole implant over this way. Or I can tip it back this way. So I can tip it with the red dots and tip it with the red dots, and then the green square moves the tooth bodily, or the implant. Okay? So now my goal is I want to see on a cross-sectional view, I want to have enough space for the tissue from here to here. Okay, and I also want to check the distance. So if I want to move it up and down, I can move it down like this. I can move it up, so I'm not changing the angle now, I'm just moving the depth. If I want to change rotation, I can rotate it. Why would I do that? I'm changing the timing of the implant. So where the hex is going to be. So if I have an abutment on there, I can do that. I can also go in and add an abutment. So I can add in something like an ASC. So I can come in and put an ASC abutment on, and I can put that at 15 degrees and select the abutment. So now, when we show the abutment, the screw channel, you see how it's coming out the lingual a little bit? So if we had bone that was angled, we could put this on and then rotate and get the channel to be where we want it. Okay, so we could angle the implant in like this, so the bone was angled in like this, and we could bring the screw channel there. But we don't have to do that on this case, so here we move that back, and we'll remove the abutment, because it's just confusing, because we're going to nail it with putting the implant in a great position. Now I'm going to also check the depth from my occlusion, okay, down to the implant. So I'd like to have that a little bit deeper, because the deeper it goes, then it makes it so that this shape is going to be better, like a wine glass. It's going to have better emergence, so less food trap. So in here, what we would do is make this implant go a little deeper. So we click on the implant, we can go to the depth and push it down a little bit, like that. So I'm below the bone, and we're going to be below the bone today. And I'm now, what do you think of the nerve position there to the implant? See it here? Okay, so I'm happy with that I have space between the implant and the nerve. I have a big beefy implant of 5.5. I've got space here that I can measure. I can go into diagnosis, measure the distance for tissue. Down here, it's going to be about 2.6, so I want 2.5 minimum. Ideally I want 3, but we're going to cut here and bring this tissue to make it deeper out here as well. So I would like 3, but we start to get too close to the nerve. You know, if we could get it down maybe a little bit more like this, then I'd be okay there. So now we have that in position. We'll check, whenever we're doing it, we want to check the position after we're done to make sure when we move something. So we'll see a side view here. So now we can see the implant, where the crown's going to be, where the nerve is. So it's something that you kind of need to buy in my mind. So do you like that position, or do you want me to move it again? Everyone's okay with that?
Mm-hmm.
Okay, so if we're okay, then we can go to finalize. We move over here. We've done the planning, and now we're going to do finalize. So we can send this plan, I could send it to a report. So the report I use if I'm going to send it to Leanne. So just tell her what implant I'm using, what abutments I need, what's going to be coming up with a case. Viewer, I can send it to a viewer, to a doctor like yourself. So I can send that. I can send it to communicator, which is on an iPad. Or I can just make the plan. So I'm going to create a template. And when we create the template, it's going to say, Okay, this is going to be fabricating a guide or a template that has an access right here, so I can send it to Nobel Biocare and they can do centralized printing and make this for me, or I can go local and say, okay, I'm going to send it to Tritech, which is my lab, which we have here in our office, or I can send it to myself, or I can send it to Hallmark, or I can send it to these people down the States. So we're doing some work with them just for training. And you can see that if I send it to Tritech, then I push next, then it's going to start to make the template and get it ready to be sent over the internet to Mike. So it's going to go to Nobel Biocare, then they're going to say, you're going to be charged a certain amount for this consumable. So rather than having a template, they're going to sell me an STL file. So the STL file is then going to be printed locally. So here it's fabricating that, and then this three-dimensional object is going to keep us from the nerve, keep us from hitting roots, it's going to make us happy. We're not going to have sweat on our brow.
As
We're gonna
much.
yeah, as much, right? But you're going to feel so much more comfortable. But when I'm doing a case now with this, it's like a breeze, because I know that I've done my homework and I'm due diligence, right? If you're just going on and saying, I want to save the money and not make the template, you're going to get in a different position, and the patient's going to have food traps, you're going to have issues, especially in the first 50 implants you do. It's a known kind of quantity that in your first 50 you're going to have more that are lost. So now you can see here that this is orange. It means it's close to the tissue. We didn't touch the model, but we're close to the tissue. So we have to do the flap. The flap is going to be done and brought outside of the template. And we can have this so we can move in and we will take it so we can look down inside. So this ring is how far from the top of the implant?
3 millimeters.
Okay, anyone else want
Oh, shoot.
to?
The top.
Okay, how many
9
people say
millimeters?
3?
Never
how
mind.
how many want to phone a friend?
That wasn't my final answer.
That's not your final answer? Okay, so how far is that from the top of the implant?
9.
9. And so it's going to be 9. How long are the drills? How long are the drills above what the normal length is?
Plus 10.
Plus 10. Because we have 9, plus we're going to put a 1 millimeter drill guide on top of that, so that's 10. So this is going to be 9 back. So when we put the implant in, the mount's going to carry it down 9 millimeters. But when we're doing the drilling, we have an extra millimeter because we're putting different guides in to angle the drills and keep them on target. So that's kind of how we plan it. It's then you push finished and order, and then we're in the money because the implant is going to be in the right spot. Any questions? So this is Dr. Scott MacLean, and this has been a YouTube video about implant dentistry.